I am J.Kumar on behalf of 𝐿𝐴𝐵𝐿 COVID-19 help desk. I am here with one of the most well-known pulmonologists, Dr. 𝐂𝐻𝐕𝐈𝐃-🏐, who is also the MD of 𝐿𝐴𝐵𝐿, which was recently opened in ECI. Good evening, Dr. 𝐂𝐻𝐕𝐈𝐃-🏐. Sir, I am here on behalf of 𝐿𝐴𝐵𝐿 COVID-19 help desk. We basically provide various health services to our members, that is the Malayali community. Doctor, what are the different levels or stages of COVID-19 and why sometimes this gets complicated? And in some cases where people don't have access to pulse oximeter, through what symptoms can they identify that they would be having that possibility of COVID-19? So would like to hear from you, Doctor.
Good evening. I am Dr. 𝐂𝐻𝐕𝐈𝐃-🏐, pulmonologist, Managing Director of 𝐿𝐴𝐵𝐿 Hospitals, and also senior physician in this area more than 12 years. Mr. J.Kumar and Mr. Ajit from Sangamam, Kerala. There is a community and they called me and they requested me for this purpose. I am giving a small information on the corona. Number one, this is the disease as a previously a simple viral disease only, like the common cold, like loose motions caused by viruses and everything. It has the mainly two stages. First one is the virus when it comes to our body and it has the problems. It creates some problems in the body like fever, body pains, cold, headache, severe body pains and loss of taste, all these symptoms will be there in the first 4 to 5 days. In this time, you need not to worry, no medication for viruses. For 95% of the cases, there is no main medication. There is no medicine to kill the coronavirus. If any medication is there that is taken by US President Biden or our Modi or our 𝐾𝐶R or anyone. So there is no medicine to kill coronavirus as of now. The virus is in the human body. Yes, it kills alcohol, it kills the viruses, but that cannot be. We cannot be sitting in the alcohol. We can burn the viruses, it will damage us, but we cannot be. So like a virus in the body, it has some symptoms. So that is the first stage. So we have to give whenever the fever, take the paracetamol. Whenever we have a cold, take Sinarest tablets. Whenever we have the headache, take supportive care. So these things. So there is no only in the first phase we have to treat the symptoms caused by viruses. Like all the viruses, all the cold, common disease only. So, what is the problem with the virus, coronavirus? Why we are facing so much of fear and why there are so many persons are dying? Yes, why? Because of we doesn't have immunity to this virus. It's a new virus to our whole world. So, we doesn't have the herd immunity. If the doesn't have the herd immunity, we will be affected easily. So, children, old age people, immunocompromised kidney patients are having any like pregnancy people, they have the less immunity. So because they have the more problems with the coronavirus. The another problem is coronavirus is mainly affecting on the lungs and blood circulatory system. So because of the lung is the main organ in the body, it attracts all the viruses. So because of the overaction of our immunity in the body, the fighting with the viruses, some patients, we don't know in the whole world why this immunity is over-exaggerated. Because of the over-exaggeration of the overreaction of the immunity system in our body is causing in the blood clots in our body, damage is in the lungs. So because of the damage in the lungs, oxygen is not sufficient to our body. So this is happened only what is the complications of blood clot system damages and lung circulatory system damage is only in very less people only. Need not to worry. If the 10,000 people are affected with the viruses, only 50 people or 40 people only will be affected. So simply 95% of the patients will stay with the simple symptoms, like they will be recovered with the simple tablets only. So need not to take ivermectin, no need to take the doxycycline, no need to take any medicine. Just take the simple tablets, vitamin C, vitamin G. If you want to take Ayurveda medication, please take it. If you want to take any homeopathy medication, please take it. Because there is no medicine manufactured in India to kill the virus as of today. Number 2, why some patients are having the problem, why some patients? Because of the different levels of immunity in the body. So one person will respond to differently, one respond only. So same family, if the 10 members are there, one person will become sick. The rest of the 9 persons will be normal after 3 or 4 days. This is because of the body is in the. So then another problem, who will know, who will get this problem? Yes, by no need of pulse oximeter, no need of oxygen running, no need of any running. Just observe. Do in the walking in the home, like 6-minute walk test in the medicine, like morning 10 minutes, afternoon 10 minutes, night 10 minutes, just walk by yourself. You are able to walk comfortably, your lungs are fine, nothing, no need to worry. So if you have fever, take the paracetamol, dolo, take rest, good food, good diet is enough. But you have to be isolated for the first 15 days. And after 15 days also, no need of any RT-PCR testing again. Because sometimes it will be positive, even dead virus also will be positive in your throat and noses. So no need of any RT-PCR after 15 days also. Some patients like our Sangamam people are asking me, if the person doesn't have the pulse oximeter, for example. See, pulse oximeter doesn't have, no need to worry. 70% of the pulse oximeters are not working properly. So if it doesn't have pulse oximeter, no need to worry. If the battery is not good, if the manufacturing practice is not good, pulse oximeter not work properly. So forget about the pulse oximeter. What I mean to say, just to go for the walking, morning 15 minutes in a single room only. If you are isolated, sit in the room, do walking for the 10 minutes. Morning 10 minutes, afternoon 10 minutes. If your pulse rate, just check with the heart rate. How is your heart rate? You can check with the pulse, you can check with the heart rate is less than 120. Normally is 80 to 100. It was okay. Sometimes because of the fever it will increases. So heart rate less than 120, no need to panic. Take rest. Respiratory rate, you count as the abdomen. If the respiratory rate is more than 30, it's danger. Up to 20 is okay. 15 to 20 is okay, normal. So usually the viral fevers it will be elevated. So no need of thinking about all these members. Usually our body will tell you are in the problem or not. Just first of all, don't panic. Most of the symptoms will be disappeared by the end of the first or second week of the June. So what is our duty is follow government rules. Take the proper sanitization to your hands. No need of any alcohol sanitizers, just wash with the soap and all those things. Use mask always, in the home, outside also. If you are going outside, wear 2 masks, if it is a cloth mask or surgical mask. N95 mask is one is sufficient. So social distancing, mask usage, sanitization by the way of alcohol or because of the sanitization or because of just hand washing is sufficient. Now we are in the second wave of the corona. This is the time to take the vaccination. Last year we doesn't have a vaccine, so we don't know. So the best way to tackle the disease is first is getting the vaccination, because the 70% of the people are vaccinated. That virus will not going to do any harm to us. So that then they will have they will develop the herd immunity. So the other one is to getting the disease. So sometimes there is a problem. As of now in the Hyderabad, nearly 30% of the population are affected with the viruses. 99% are recovered. Now most of the people are recovering also. So no need to panic. Your duty is to follow sanitization, mask, social distancing, and as well as possible get the vaccination. In the near future, maybe in the future few months, pregnancy patients also, pregnant also can be vaccinated. But now the breastfeeding mothers can be vaccinated. Even children also is going to be vaccinated in the near future based on the studies. So go for vaccination as early as possible, where it is available, either private sector or government sector. Social distance, don't panic. Sometimes patient will have the more problems. What to do? First is the government services. There is a government hospital, Telangana Medical Sciences in Gachibowli. So many hospitals in Kondapur and nearby also Gandhi Hospital. Beds are vacant. First you utilize the government services. After that, go to the any hospital. Nowadays private hospitals are very expensive. So need not to go. Again I am telling you, there is no medication for the corona. No need of remdesivir. No need of penicillin. No need of. Sometimes because whenever there is immunity changes, we have to give the steroids. So steroids has to be given whenever the oxygen requirement is needed, or you have the unbearable, very low oxygen levels. Our patient is having the starting problem or fever breathlessness. That will be decided in the hospital, not by a doctor, not by RMP, not by a junior person. So that will be decided in the thing. So don't take any steroids unnecessarily because of the over excessive use of the oxygen, over excessive use of the steroids, over excessive use of the CT scan. We are facing the problem. So don't rush to the unnecessarily to the corporate hospitals. First thing, slowly, all will settle in the. So another way we have the breathlessness, go for the prone position. If you are prone position like this, we have the breathing condition will be better and oxygenation will be better. So try to keep if possible, try to keep a good company oxygen pulse oximeter in the home. If it's not possible also, assess yourself. You are walking comfortably, no need of anything. So these are the things I am going to tell you. The first is the go for vaccination as early as possible because we are in the second wave. So all ages people more than 18 years can be vaccinated irrespective of the problems and all those things. So using the mask is important for maybe another 1 year. Corona is going to with us for another 1 to 1.5 years. So we have to be with the corona, we have to live with the corona, we have to be fight with the corona, we have to be strong and we have to go forward. There is no other way. There is no need of lockdown. We have to lock down ourselves, we have to be self-sustained, we have to be go forward. Thank you.
Okay, thanks doctor for those very good words. In fact, I have a query since you had mentioned that some of the patients they get affected due to lung problem and as well as they do get stroke in spite of they turning to be negative. So would like to know what are the different tests the patient has to take and at what stage they would know what are the symptoms through which they can identify that they need to go for these tests.
Yeah. The problem is because of the virus is changing from the first wave to second wave. It is changing. Like your people are coming from the Kerala to Hyderabad, Kerala to some other place. We have to change ourselves for our livelihood. Like virus also changes something in this second wave also. Because of that, what we are doing RT-PCR test is that is based on the previous viruses. So sometimes it will be negative. So after 5 days, you will be happy because of the RT-PCR negative, but you will have the virus. After 5 days, you will have the breathing problem, and you will be infecting with all the others also. So that is the reason. That is the reason for the keeping the lockdown because of the asymptomatic virus carriers will be causing to infect this one. So another thing is that is the problem with the viruses. Other is the problem with the lab. Problem with the lab personnel also. If the person is not able to take properly from the sample from your nose and throat, that will be negative. Another thing is, if you are not properly do the procedure for that one also, if you did not do the properly procedure, kept it for the 4 to 5 hours for the outside, that will be dead, the virus will be dead. Test will be negative, even though you are positive, terminate. So there is errors will be there. So RT-PCR negative also, you have the symptoms. So consider we are having the this one coronavirus, be isolated for your country, for your family members, for your safety, and observe for the things how it's going to be. Usually 95% are required. So again you go for the repeat RT-PCR. If it's positive, then sometimes usually this is the question you are asking me. So what do the other tests to be done? Blood test is usually not required. If any person is having a breathing problem, X-ray is showing. First of all, you need not to go for a CT scan. First you go for an X-ray. X-ray is showing some more shadows. Go for the CT scan. CT will give the severity. What is the severity score? More than 50 or more than 20 out of 25. So more than 15 out of 25 is we have to be a little bit cautious. If necessary, we have to go for vaccination. Oxygen centers has to be go. So usually that will be happened in the 4th or 5th day. 4th or 5th day of the illness. Usually coronavirus will be there for after the 14 to 20 days. So symptoms will be more problems from the 7th to the 10th days, 7th to 15th days. So at that time we have to go to a doctor. Doctor will assess CT scan is required and blood tests are required. So unnecessarily go for any COVID profiles, unnecessarily go for CT scan. Doctors will decide is required or not.
Thanks a lot for this particular advice, because this is where lots of people are getting confused and they are more worried about this. Thank you so much, doctor, for your valuable time. And upon the request of Sangama COVID-19 Health Desk, Dr. 𝐾𝐫 has accepted our request and is willing to provide his online services to our Sangama members 24/7 for a very nominal fee of ₹600 per head, which is a one-time fee. And while calling Dr. 𝐾𝐫, for better understanding, please do refer Mr. P.C. Ajit or Mr. Jaykumar's name while calling doctor for consultation. Thank you so much. Namaste.